Now, you may be very well aware that there's been a number of incidences that have been unfortunate when it comes to your health. And of course, the question we'd like to ask is, what are the patient's rights? And just to quote a few, we have an incident in Busia not too long ago where some children went through a vaccination, and as a result, they had paralysis. Thank God Nairobi Hospital stepped in and that was sorted out. But not in the too distant past, like yesterday, there was a report of vaccination exercise in Elgeyo Marakwet for measles, and 2 children lost their lives. 7 were admitted. They have now been discharged. However, of course, the question remains, what are the patient's rights? We also have the rogue doctor who is still at large, who of course many of us may be well aware of what happened. He would drug his patients and rape them in the process. So of course there's that pertinent question. And to help me with that discussion this morning, we have Dr. Francesca. Is it Francesca or Francesca? Francesca Ongecha, who's a psychiatrist and lecturer at the Department of Medicine at Kenyatta University. She's also the co-convener for Patient-Centered Care, a conference that's going to be taking place, and we'll be talking about that as we go along. Thank you very much for joining us, ma'am.
Thank you.
I also have Dr. Elio Port, who's the chair for Kenya Medical Association. And let me start with you, Dr. Eli. What could have gone wrong in these incidences?
Well, I must say the incidents are very unfortunate, but as it has turned out, you are aware now, we've confirmed the people who actually administered the vaccination. In both instances, they're not doctors, neither are they nurses. So the reality is that there are people who are finding a loophole and pretending to be clinicians and giving these injections. So we perhaps need to really look at how we sift these people who go to work.
So in both cases of the vaccinations where we have paralysis and the children who lost their lives, it is not an issue to do with medication used?
It's not an issue to do with the medication used. It's the wrong person giving the medication wrongly. Yeah, because if you're a trained person, there's a specific way you're supposed to give those vaccines. And in both instances, we now learned, like the latest one, it's now been confirmed that this was actually a cleaner in a hospital for 8 years and never stepped in any medical training school at all. But yet, because he'd worked in the hospital for all this year, the people thought he was a doctor. So
how do we get to a point where a cleaner administers and becomes one giving vaccinations in a health center?
And that's the reason why I'm saying perhaps our monitoring and vigilance system has allowed some loopholes that allow people to pretend that they're doctors.
Okay. Dr. Yes. Francesca, what do you make of incidences like this?
For these particular incidences, as Dr. Nyaima said, it's quite unfortunate that that happens, and that some of the so-called health service providers are really not trained for the services that they are offering, and probably closer supervision needs to be put in place to ensure that Kenyans are safe. Yes.
Okay, Dr. Eli, where does the buck stop when it comes to an incident like this? Because the patient, when you walk into a hospital or when you have health officers who have been dispatched to vaccinate, we are under the assumption that they are qualified.
Well, it's a very complex scenario, really, because like she said correctly, it starts off from this provision, and particularly at those institutions. And we assume that we'll be able to post healthcare workers, enough of them in every institution who are able to coordinate these things and supervise and do what they're supposed to do. But unfortunately, as we all know, the health sector seems to be going through a lot of challenges, particularly since devolution came in. Because the first instance is that the human resource for health is quite constrained. We actually don't have enough people, and that cuts across all the cadres. And then now we introduce these complications where the postings and the payments and the career progressions are in a lot of doubt. I think that has now created very big loopholes where people now find a chance to go and pretend that they're doctors. And the other flip side is that as a common man, like you said rightly, when you walk into something called a health center or hospital, you go with the trust that whoever you find there will be. So we need to step up our education of the public, but we also need to very, very urgently step up the issue of looking at the issue of human resource for health.
Okay.
And address it.
Dr. Ongecha, now in incidences like this, where does one run to? Where do you start? When you've had a grievance, possibly with a health center or a health worker?
There are channels of raising complaints and blowing the whistle for what is happening around the health facilities. There's normally, there are different cadres, and also there are particular organizations that deal with this, but even within the Ministry of Health, the system itself, there's a supervisor of that institution. From there, there is the county in the current scenario. There's the county office, and we also have the national office. And specifically, we have a directorate for standards and quality that actually deals with these particular issues. So for the Kenyans, there's definitely a pathway. That,
so where would one begin? If this now is an incident you're dealing with, where do you start? You're at the health center, you've been treated not in the way that you should be, or a health worker has done something that is not supposed to be done. Where do you start? What office do you go to?
When that happens, you get to the county director of health offices. There's a county director of health that deals with delivery of health services. Yeah? So you would put your complaint. There's a medical superintendent or the person in charge of a particular hospital. So you raise your complaint to the hospital itself, and of course, again, if nothing much happens, you move to the next level. Yes.
Okay.
But perhaps just to assist her, in addition to the structures that are set within the hospital and within the ministry, we also have the national regulatory authorities, and those are the kinds of the Medical Professional and Dentist Board, the Nursing Council of Kenya, and the clinical officers. These are the people who license the practitioners for them to be able to work. And all of them have a channel for complaints. So apart from reporting to either the nursing officer in charge or the medical officer in charge of the institution, you can actually also lodge a complaint to the Medical Professional and Dentist Board, or the Nursing Council, or the Clinical Officers Council, any other of those, and they have the mandates actually to investigate that once complaints have been lodged.
Okay. Yes. Dr. Ongecha, the conference that's coming up, patient-centered care. One would imagine that naturally the care is really meant to be patient-centered. Is there a difference?
Yeah, the difference, the purpose of this particular conference that is coming up in end of this month, that is from 29th of September to 2nd of October at Kenyatta University, is specifically to interrogate that aspect of patient care. Just like any other business, there's normally the issue of customer care. The customer comes first. But in terms of training and delivery of service, the models that have been there, health has actually been evolving. Yeah? So that we started from issues of spiritual causes of health, then we moved to scientific and more so disease oriented, so that many times we found that we look at patients in terms of diseases. Many times the clinicians look at patients in terms of diseases and forget the whole person care because of the science that has come in. And so we are trying to move back the practice to, and that's the model that is now being evolved. Not that it has not been there, but now the emphasis is being brought back to the patient, so that it's like you can't do anything without me. Involving the patient in decision making, in care, in treatment, and the patient's family. Not looking at the disease as the priority. Again, not leaving all the decisions with the clinician, which has always been quite the prominence in the 20th century. So in the 21st century, we want to bring it back to the patient.
Okay, you find that sometimes if you question doctors, they feel like you're trying to question their credibility and question their professionalism. Is this something that a patient should do, especially when you don't understand some of the things and terms that they use?
Yes, that is what we are saying, that's the reason why we want to emphasize the aspect of patient-centered care, because the patient should be able to be part of the decision making. They should be able to know what they are being treated for, or what they are suffering from, and what it means to them, and also all the options of treatments that are available. So it is what we are basically saying, that it is actually their right, and it is important for them to be able to ask those questions, because we need their involvement more than anything else, and especially given that even our constitution, the new constitution that was promulgated in 2010, gives them that right as citizens of Kenya.
Yes, sir.
Yeah, I just wanted to add, just like you said, times are changing. I'm also a practicing surgeon, actually, and I also teach medical students at the University of Nairobi. And we are putting an emphasis that the patient must have the right to know what it is that you're doing to them, what it is that you're treating, and they have a right to question. And in fact, at this point, I want to draw your attention that there's actually something called the National Patient Rights Charter, developed by the Ministry of Health and the regulatory authorities and the professional associations. It would be something that would be nice to disseminate so that patients actually know what are their rights and obligations. And like you said correctly, you have all the rights to question what a doctor is doing to you. And remember, a lot of procedures require that there's a consent from the patient or from the relative or from a competent guardian before you proceed with that.
Okay. So, let's talk about rogue doctors. And we have an incident that happened not too long ago, and evidence comes out that he had been banned and stopped from, even having the clinic running. However, somehow he managed to get back. What measures are in place to ensure that the public is protected from such?
All right. First of all, for you to open a medical institution, either a clinic or a hospital, you must get the requisite registration and the licensing. Now, the registration of facilities is done by the medical practitioners and dentist board, and there's applications that are done, and there's a procedure that is followed. Once you get registered, you must first of all submit your documents. Inspection must be done to confirm that this is actually what you're purporting it to be. And then annually you're supposed to apply for annual licenses. And in between, there's need for continuous inspection. And as exists now, I know the medical professional and dentists, but together with the other councils, do what we call joint inspections. Now, the only problem is that when you go to a region and joint inspections are done, the quacks will know that these people are around. And so that, during that period, they behave very well, and actually they even close those things. Now, the shortcoming that I'm seeing is the follow-up and monitoring. Like, for example, this rogue doctor you're talking about, the clinic was actually closed in June, and he was arrested and taken to a police station. But within 2 days, he was a free man. And then, of course, you now know he continued to practice. And I also want to point out that I'm actually very worried that a whole police force can actually say that 1 week since this thing happened, the man cannot be found. And we're aware that he's even updating his Facebook pages. So that alone raises a lot of questions, because if you are really vigilant and you're keen on follow-up once something has been done, I don't think we'll have reached this point. Yes.
So in a case like that, what was lacking? Is it the follow-up? Is it that those who were supposed to do the inspection were not there? Is it the numbers? They're not enough to cover the, the areas?
Well, I think it's a combination of many things. Number one, the capacity for sure is not enough, because all these regulatory authorities are actually centered in Nairobi. And if you find the number of members who sit on the board of all this, very few people. And even the staff complement that they have is very small. So the assumption is that they will be able to work with the county governments and other government agencies, including the police, so that if it is closed, let it remain closed until you have actually met the criteria that allows you to be opened. So for me, the issue of monitoring is what is lacking completely. And then enforcement perhaps is also a problem.
Okay.
Yes.
All right, Dr. Ongeche, let's talk about the nurses' strike, which has been happening in several areas. Again, this leaves the patient very vulnerable and at the mercy of whatever is going to be decided. Isn't there a code of conduct that would restrict nurses from going to a point where the patient is left literally on a deathbed?
For the medical professionals, all of them have a code of conduct, and that is implemented in many institutions and basically by the health workers. But as we are all aware, even with the code of conduct, the person needs to have motivation to work. Yeah? The person needs some basic necessities to be able to provide work or to provide a service. even for anybody with an empty stomach, it would not be very easy to do what you are required to do. Yeah. But we all understand and we are all aware that they've had communication has been going on, and the same laws apply to everybody, but the bit of the code of conduct should actually be upheld in the circumstances of the best possible way of implementing a service.
Are
That's
they
what I
in
would
breach
say.
of the code of conduct when they down their tools?
I wouldn't really say yes or no. I wouldn't say yes or no, but at any one time there's always for emergency care that is always provided at all times.
Okay, although we've had instances where people are turned away regardless of their health situation. They could be a matter of life and death, but they actually turned away. Dr. Eli, what's your take on the strike? I mean, it's a very fine line we're walking here, because we're looking at human rights either way. Yes. The nurses have their rights, and they really have a valid, or would like to, according to what they're pushing for, they have a case. But you also have the patient, again, who's left at the mercy of whatever decision will be made.
Like you said, it's a very thin line, yes, and I must say the way health professionals are trained, they put the focus on saving life. And like my colleague has rightly said, we must look at the bigger picture, because the situation is that we are all very quick to condemn the health workers, the nurses and the doctors, but we're not interrogating the environment in which they're operating. Now, you're posted to this place, you've not been paid for 4 months, there are no medications, the facilities is completely run down, and yet somebody expects you to continue performing a miracle in, day out, and continue smiling. So that's why I'm saying it's a very difficult thing to handle, because when you talk about human rights, yes, the patient has rights, and you've been trained and you've taken your oath and all that, but you're here and you actually you've not been empowered and facilitated to do what you're supposed to do. Okay. Yes.
All right, we need to wind up. Dr. Ongecha, what are the details for the conference?
Yeah, the conference is going to be held, it's an international conference that will be held at Kenyatta University, the Kenyatta University Amphitheatre, which is in Nairobi, and it will start on 29th of September to 2nd of October. We are interrogating patient-centered care, and we want to look at training and delivery of universal health care to the people. We have several sub-themes to interrogate, from training, medication safety, funding for health, research.
Is everybody welcome?
Yes, this is for everybody. If you've been a patient, if you've taken care of a sick person, and which I believe every one of us has. So we are basically saying that this conference is for everybody. Okay. Yes.
We'll need to wind it up right there. And thank you very much, Dr. Francesca Ongecha, who is who's a co-convener for the Patient-Centered Care Conference that's coming up. Dr. Eli Opot, who's the chair for Kenya Medical Association.